Welcome to Austin, Texas at the Austin Convention Center, and we're at the annual meeting of Women's Cancer of the Society of Gynecologic Oncologists, where the best of gynecologic oncologists, medical oncologists, and all those who are caring for gynecologic malignancies come together to collaborate and to educate, all looking forward to a goal of eradicating gynecologic cancers. We came to the annual meeting of Women's Cancer so that over the next few days we can interview some of the researchers that are presenting their papers and their abstracts and their posters, and giving you an opportunity to see what research is being done to help patients who are fighting gynecologic cancers every day.
Laura Heverleski, and I'm a GYN oncologist at Duke University.
David Miller, I'm from the University of Texas Southwestern Medical Center.
I'm Matthew Powell from Washington University in St. Louis.
Peter Lim, I'm a gynecologic oncologist, and I'm at Center of Hope.
Kathleen Moore, I'm a physician, a GYN oncologist at the University of Oklahoma Stevenson Cancer Center.
John Curtin, I'm the current president of the SGO, and I'm from New York University Medical Center in New York City.
Warner Huh, I'm a GYN oncologist at the University of Alabama at Birmingham.
Can you describe a little bit of what you're presenting and what are some of your findings?
So what we have done is to build on the knowledge that's already been obtained about PARP inhibitors in patients with BRCA gene mutations, because it turns out that there may be a much larger group of women who have the same problems in repairing DNA damage as the women do with BRCA gene mutations. And this is a group of women who have the most common type of ovarian cancer, which is high-grade serous ovarian cancer.
Can you introduce yourself and tell us a little bit about your abstract that you presented today?
Absolutely. My name is Amanda Nichols-Fader. I'm a GYN oncologist based out of Baltimore at Greater Baltimore Medical Center and Johns Hopkins Hospital. And I presented an abstract today on a specific type of ovarian cancer. It's called low-grade serous cancer. And we talked about some of the factors that are associated with improved survival with this particular type of cancer.
Yesterday, you were part of a pro-con discussion with Dr. Powell, which is also in an interview on the site, and you were talking about specifically endometrial cancer and surgical care. Can you describe a little bit what you were talking about and some of your opinions that you were presenting?
Sure. Well, there's not really a standard of surgical care for women with endometrial cancer, which is a bit of an embarrassment since it's the most common gynecologic malignancy. So in order to push the field forward, the debate was about which group of patients we should study in endometrial cancer to really learn something and change our practice.
I'm here with the next SGO president. I'm going to have him introduce himself and tell where he is from.
I'm Dr. Ronald Alvarez. I'm a professor and director of the Division of Gynecologic Oncology at the University of Alabama at Birmingham.
This meeting is one of many meetings that SGO puts on, but it's the largest in the kind of the spearhead of other events and meetings. What's the importance for, as a professional, as a physician, as a medical oncologist, as a nurse that comes to these? What do they gain from being at an event like this?
Well, the Society's interest is predominantly on the patients that we take care of and trying to help them either eradicate gynecologic cancers or lessen the impact of gynecologic cancers on the lives of the women that we take care of. So it's very important that we focus on a couple of things. One is that we need to make this team of people that are the members of Society of GYN Oncology the very smartest they can be about gynecologic cancers, about not only the how to treat patients, but how to prevent it, understand the biology of it, what's the new directions we're going with new developments, both at the basic science level as well as the clinical research level. And working together, I think we will help ourselves get smarter. And then the other key thing that we're focusing on is how do we take these group of people that are, the most educated people about gynecologic cancers and help them deliver that cancer care in the most cost-effective, high-quality manner. And those are some things with the new restructuring of the Society of GYN Oncology that we're hoping to be able to do better in the future.
When you're at these events, can you kind of explain the difference between what happens inside the big meeting rooms and the sessions, and then maybe what happens at some of the camaraderie and the talk that goes on that makes you as physicians sharper because you're together at events like this?
Well, the Society of GYN Oncology is still relatively small compared to many other organizations. And, this life is a team sport, and we have very good close relationships with many of the people that are part of the society, and it's from these close relationships that we develop that we develop the opportunity to work together in research, in the clinical practice, and collaborating in many other ways to accomplish our mission. And so it's those deep friendships that we have, I think, that really allow us as a society to be able to be really advocates for our patients and see the care of gynecologic oncology or gynecologic cancers improve over the time.
As the incoming president, and obviously you've been president-elect and part of the leadership here, what are some of the things you see in the, obviously next year and in the near future that are going to make the SGO and the membership and the patients they serve make more effective at actually eradicating these cancers that we still all dream about doing?
Well, there's this little thing called healthcare reform that's we're actually in the middle of deciding which way that's going. I think regardless of what happens at the Supreme Court level or even in the political landscape, that healthcare reform is upon us. Whether it's going to be driven by government or the private sector remains to be seen. But we as a society need to get our members prepared to embrace the changes that are coming with healthcare reform, and again, to be able to not only be the smartest people we can be about gynecologic cancer care, but to be able to deliver that high-quality care in a very cost-effective manner, which we need to do. We need to be the individuals who are driving those changes forward. So we are understanding our responsibility not only to the patients, but on a larger front. What this delivery of this care does to our healthcare expenses here in the United States.
And this was just a short overview of what's happened here at the annual meeting of Women's Cancer. Please click on the playlists linked here in this video where you can see more of the interviews and more of what happened here at the annual meeting of Women's Cancer in Austin, Texas.